Welcome, everyone. My name is Nicole Pratt, and I work at the Spam Parent Advocacy Network. And today's session will be on using social media and technology to increase engagement across the programs. And I'm now going to have the two speakers introduce themselves. Meedra?
Thank you, Nicole. Hello, everyone. Thank you for joining us. We're so excited to share this information and to be with you today. My name is Meedra Surratte. I'm the Executive Director of Parent Information Center of Delaware. We're the PTI for the state of Delaware, and I have joining me and co-presenting today, Christina Andrews. Tina, you want to introduce yourself?
Hi, my name is Tina Andrews. I am the project coordinator of the PTI, and I have worked with PIC for many, many years. And I have children, many children with special needs, and I'm very excited to talk with you all today about social media and technology. Okay, so we're going to start. I'm going to ask that everybody have a piece of paper and a pencil that they can work with through this session, because we're going to ask you to jot some stuff down. So we're going to start with this. There are 27 figures of speech in this photo. So I'm going to have you, for the next minute, write down as many as you can find, and then we're going to work with that. So you have 1 minute looking at this picture, as many figures of speech as you can find. All right, so pencils down. Now we are going to use the chat feature. So we have a chat feature. Hopefully you have used it. It should be at the bottom of your screen. You are going to put in some of the figures of speech that you came up with during that 1 minute. And then if you see one that you have not gotten, you can add it to your list. So just take a few seconds and add one or two into the chat feature.
We have quite a bit coming in, Tina.
I see. So, some of them serve like a red herring, cat by the tail, bird brain, piece of cake, eggs in one basket, spill the beans, hook, line, and sinker, eye of the beholder. So I have done this many times and I have never gotten that one. Time flies, nail in the head, nailed it. Silver spoon. All right, thank you so much. So we like to do this exercise when we are getting ready to talk about implementation science and social media, because how many of you, and you can put a yes or no in the chat box, how many of you found it easy individually to come up with a lot of these figures of speech? So if you found it easy, yes. Okay. So some people found it yes. Who found it easier when you were collaborating with the entire group? When you had some ideas about what other people were thinking? Did that inspire you and bring some to mind? Yes, it helped. Thank you. easier when collaborating. So the point of this is that for some people working individually, they can come up with a lot. Some people need that collaboration because English might not be their first language. They might have a disability. They might have a visual impairment. English might not be their favorite subject, and figures of speech, right? There are many reasons that this exercise might need to be modified and might need to be a collaboration exercise. In the same way, we're going to talk today about your social media that you're using and the implementation process in order to make sure that it is as effective, is reaching the families that you intend, and how you're going to gather that data and then make changes. So we're going to go in through the whole process, and we're going to use some examples from our work and from the work of parent centers. First, in the chat box, I want you to put your name, your position at your parent center, and then an interesting fact about yourself. And there are a lot of us here, so 90. But that will be there, and you can refer to it and look at that. But we will also be able to see where a lot of our participants are from and interesting stuff about them. So please add your name, your position, and then an interesting fact about yourself. And Meedra, do you want to discuss the learning objectives?
Yeah, so we'll continue to monitor the chat. So continue to update the chat with your and introduce yourself. But today we're going to talk about implementation science and its application to program development. We're also going to participants, and hopefully you will have an understanding of how to use data and implement data in terms of your program delivery and implementation to your service programs. So we're going to talk about the different data sets and the different uses of data and how we can use and study that data to modify our programs. And then lastly, we're going to, hopefully you'll have an action plan or steps in identifying methods on strategic engagement using social media and technology. And so we wanted to start with our challenge and present to you the issue that we were experiencing as an organization. We were spending an incredible amount of time on calls and inquiries and not necessarily providing as much TA, universal TA through our social media platforms. And so it was creating a lot of, we were using a lot of time working with families one-on-one and providing that one-on-one assistance, which is necessary at times, but we weren't really utilizing the technology and other systems and other forms to engage and reach our audience. And so there was a plan to increase our social media presence and increase engagement with our viewers. And so this shows almost a comparison, and we'll go into the process of how we were able to do this, but we were seeing a lack of registrations in our webinars and in-person trainings. We were seeing limited engagement on our website, and we were also seeing limited use of social media through our platforms. And so when we're talking about implementation science, what is it? It's the study of how evidence-based programs can be used and embedded to maximize successful outcomes. It's systemic, and it's a process. It's also a scientific approach to identify the range of factors which are likely to facilitate the intervention that we are planned outcomes that we're looking for. So we have a brief video that we want to show you as it relates to implementation science, and we thought that this was they did a great job of explaining implementation science in a practical manner.
The evidence is clear. A healthy, active lifestyle is good for you. So, you've gone out and bought yourself a treadmill. You've wrestled it into your bedroom and you've slid it under the bed where it sits and sits. You know you want to get into shape. You want to implement the treadmill as a catalyst or vehicle for improving your health. But unless you can corral the will, the motivation, support from friends, advice from your physician, agreement from your family to leave you alone while you walk or run, and all kinds of other factors, the treadmill will continue to produce dust bunnies. Just buying the treadmill won't make you healthier. You need a plan, and you need to implement and evaluate that plan.
Sorry, everyone. Take two.
The evidence is clear. A healthy, active lifestyle is good for you. So, you've gone out and bought yourself a treadmill. You've wrestled it into your bedroom and you've slid it under the bed where it sits and sits. You know you want to get into shape. You want to implement the treadmill as a catalyst or vehicle for improving your health. But unless you can corral the will, the motivation, support from friends, advice from your physician, agreement from your family to leave you alone while you walk or run, and all kinds of other factors, the treadmill will continue to produce dust bunnies. Just buying the treadmill won't make you healthier. You need a plan, and you need to implement and evaluate that plan. A simple dictionary definition describes implementation as the process of putting a decision or plan into effect. In our world, the decision or the plan generally relates to the process of introducing or integrating evidence-informed interventions or research findings into our day-to-day work. There's a very important word in there, process. Implementing evidence-informed practice is an active process, and it's a deliberate one. You can't snap your fingers, send an email, and sit back and wait for the magic to happen. But if you take the time to integrate some proven strategies, you'll set yourself up for success, both now and in the future. Successful implementation is about engaging stakeholders from across the organization in the process of strengthening, integrating, galvanizing. So the organization asks itself, what do we want to change and how can we get there? That opens up these questions as you explore the possibilities. Who can do it? Determining capacity and resources. How do we do it? Determining the nuts and bolts of the course of action. How do we train for it? Analyzing capacity and connecting people to knowledge. How will we evaluate it? Finding the right path for evaluation. And how will we capture our experience so we can share our knowledge with others? Finally, when these processes are in place, we implement the results in a sure-footed, measured way over time. Implementing evidence-informed practice depends on your ability to channel other forces too. Leadership, teamwork, managing the changes at the practical and cultural levels, mentorship, coaching, supervision, and support. And at the end of the day, investing in implementation means far more effective outcomes. And that translates to a higher level of organizational performance, a stronger commitment to being a learning organization, and ultimately, better service to children, youth, and their families. It's worth the effort. Agencies that successfully implement a new evidence-informed practice come away with valuable skills in leadership, teamwork, evaluation, and change management they can keep using to strengthen their team and their services. And, as we've said, more than anything else, implementation means better outcomes for the people we serve. We want to help you to be successful, to stay inspired, and have access to all the skills necessary to master implementation. The Center offers...
Okay, so hopefully that gives a better explanation and a visual in terms of implementation science. And Tina, I'm not sure if you are monitoring the chat, but I did see that it seems to be some consensus in terms of the explanation of implementation science in the video. And so in thinking about implementation science, what are your initial thoughts about how this can be used within your organization? So begin to think, and you may already be thinking about some challenges or a challenge that you're facing within your organization. What are some ways that implementation science can be used and might be useful in your work? And so we're just going to take a few moments to capture that information.
So we're going to ask you to write it on the sheet that you originally wrote, started with, and we're going to refer back to it later on.
And so the Plan, Do, Study, Act, or PDSA, is a cyclical process. And it's based on quality and improvement process that allows an organization to test and analyze a change on a small scale. It's used in many areas. So you may have heard of PDSA in the healthcare field or even in education. In fact, the Vermont Department of Education uses the PDSA as it relates to implementation in their programs and services. Also, the Center on Positive Behavior Supports and Interventions, PBIS, also uses PDSA and uses it and actually recommends it as a effective tool in implementation of PBIS programs within schools and state systems. So it is a tool that is commonly used. As I mentioned, it's a cyclical process. And so when you're thinking about the PDSA cycle, and many of us are already doing some of this work. So you are thinking about, okay, what is the challenge? What is it that I want to modify, or what do we need to improve? We're looking at the data. What is our data telling us? How do we make the implementations? We study the data. Is it in fact working? And then we reevaluate or reassess the process. And that's all the PDSA or Plan, Do, Study, Act framework is. It's a lot of what we're currently doing in our work, but it's really the key is that it's a systemic process and implementation. And so let's take a few moments to apply PDSA, and let's look at Parent Center A. So Parent Center A is conducting webinars as outlined in their grant objectives, which is what they should be doing. They are noticing that they're not getting many families participating, so they're not seeing a lot of registrations. And therefore, they're now pushing a lot of their webinars out to the social media platforms to increase engagement. And this has been very effective. However, they're now seeing a new challenge. They're seeing an increase in their engagement via social media, but now they're unable to capture the demographic data that they need for their funders. So using the poll, and you should see a poll pop up, we want you to select from one of the following. Which of the following would be the most effective in terms of next steps to address this issue? A, conduct focus groups with parents or a survey asking why they're not participating in webinars, record an intro of the webinar only to push out to Facebook to gain interest, or do nothing and hope for the best. And so hopefully you're seeing the poll.
Yes, they are, Meedra.
Okay. And Tina, are you seeing results?
Yes, I am.
You want to share some of the results that you're seeing?
Yes. So right now we have about 82% of our group that has voted, and the majority, so 68%, have voted for A, conduct focus groups with parents or a survey asking why they are not participating in the webinars. 32% have said B, record an intro of the webinar only and push out to Facebook to gain interest. And then no one has done C, which is do nothing and hope for the best. So the majority are going with A right now.
And the thing here is that A or B could be correct. Because when you're thinking about applying PDSA, remember it's a cyclical process. And so part of this process would be that there would have been a discussion on what are the challenges that we're facing and how do we address this particular issue. And so as you're going through that process collectively as a group, you may have determined, some of you may have determined that conducting a focus group is the best course of action or the next course of action. Some of you may have determined that recording an intro of the webinar and only pushing it out to Facebook is the best course of action. So it's actually, it could be both. It's really just the purpose of this activity is just to get us to think, to see that this is really an ongoing problem solving process. But thankfully no one selected C in terms of do nothing and hope for the best. We know that does not gain the results that we are looking for.
And I love that in the video and what Meedra said, that you're going to involve your stakeholders. You're going to be sure to communicate to everybody that this is a process and that you are going to reevaluate and evaluate how well it's happening and be able to update, change it based on that feedback. So it's not one or done.
Exactly. And so when you're talking about, again, PDSA, and I mentioned this before, you know, this is how we began to address the issue. So we looked at our specific issue and we noticed that we were spending an incredible amount of time on calls and inquiries, but then we also had the additional challenge where we were hosting webinars and we were not getting the participation, we were not getting the engagement. And so our plan at the time when we talked through some of these challenges collectively as a group, we wanted to utilize social media. We were comfortable with social media. Our staff were comfortable utilizing social media, in this instance, Facebook. And so we wanted to use that to increase our engagement with our viewers. So we began to push the webinars out to our Facebook pages. And we started to see an increase in engagement, with the unintended consequence that we then started to see a decrease in the number of hits to our website. And what we were noticing is that we were spending so much time pushing the information to our social media pages that we had not thought about the unintended consequence of individuals not, or families, stakeholders, not utilizing the resources and the tools on our website. So again, look at this process. The plan was to increase our presence through social media. We did that. And then we looked at our data and we studied, was the process carried out as planned? What worked? What didn't work? What did the data show? And then did we need to adopt or abandon this plan? And in our case, we made some adaptations in terms of, we then moved the webinars we uploaded them to our website and began to push from our website to our social media platforms to then increase the engagement on our website and continue the engagement that we have already established on our social media platforms. Ina, did you have anything you wanted to add?
Just that it's really critical that you do this planning with your staff, with your stakeholders, because each parent center, each organization is very different. And you know, our state has some unique challenges, and we would go to workshops and different, you know, educational things and hear about these ideas. But when we brought them to Delaware, we did not have the same success. So, you know, we really have to look at our families, our parents, and decide, you know, what makes sense and what we're going to plan and do, and then study whether that's effective for us.
I would also add to that part of this process, and you mentioned our stakeholders, but also be thinking about your staff. Who's going to carry out the work? So for example, in our instance, where we decided that we wanted to push everything out to social media and we wanted to utilize our social media and increase our engagement through social media, we're also thinking about who's going to do that. In our organization, we're a very small organization, and so we wear multiple hats. And so as part of this process, as you're planning to make change or to address a particular challenge within your organization, you really have to think through who are the individuals that are going to carry out the work. And then as part of the process, as you are analyzing the data, you're looking at the data, you're assessing, is this working? Has this in fact worked? You also want to look at, part of that process is looking at, checking in with your staff, the staff who are responsible. Are you noticing that they're spending an additional, incredible amount of time or significant amount of time now with this new task? Are they less efficient in their work and carrying out the activities because of this task? Are there additional training opportunities that are necessary? For many of us, social media is an entire new world. It's an entire new world for us. And so just navigating through different social media platforms, understanding the data, looking at what the data is telling us, understanding the insights in this instance with Facebook. There's a learning curve that comes with that. So I want to also emphasize that when you're working through this process and you're applying this process, that you really want to be intentional in thinking about who are the staff that need to be a part of this process and what supports are available for them. I will also add, utilize the existing resources. There are many of us that are part of PTIs or CPRCs. So there's a network of resources that are available to us through the SIPR, through peer-to-peer networks, which will look at peer-to-peer trainings, which will look a little differently now. But those were some opportunities that we took advantage of. We reached out to some of the PTIs in our region who were doing what we achieved to do, or doing well, appeared to be doing well. And so we reached out to them pre-COVID, of course, to find out how they were utilizing their data and how they were reviewing their data and what training was necessary, and also to train our staff. So, when you're thinking about this process, it's really just, think of the video and think of the treadmill and be very intentional about who needs to be a part of this conversation, who needs to be involved, and then really looking throughout the process and making modifications as needed. And so this is part of our wonderful team at work brainstorming. And so also wanted to talk about data. Data is everything. We use a number of different forms of data, including Salesforce, which is our database, Facebook Insights, Google Analytics. We also have a website analytical report that is sent to us from our web developer, and we utilize our online video portal. So I know I've said this a few times in terms of the PDSA process being a cyclical process, but it truly is. And so we're constantly evolving, and we're constantly improving, and we're constantly reviewing our data, and we're looking at what is our data telling us. And when you're looking to modify and implement programs or implement changes in your programs and services, you really want to look at what is your data telling you. So that means you need to be knowledgeable about your data sources and making sure that you're comparing apples to apples. Tina, was there anything that you want to add? I do want to share some screens as it relates to the data that we look at and our insights, and I just need to switch out my share. So if there's anything that you wanted to add.
Yes, so I just want to add, as you were just talking about the importance of involving your staff and also making sure that they can use these tools, and that you are using the tools in the fullest capacity available. So, we're still learning all of the tricks of the technology tools, the data collection tools that we use, but they are constantly also evolving and able to provide more more features, especially right now during COVID-19. A lot of these systems, Zoom, Salesforce, all of them are responding to the needs of people that are now suddenly online a lot, and the school systems and the organizations that are supporting them. So keep up to date in terms of your technology tools, your data collection tools, take advantage of webinars and information that's coming out, because we have learned in the last few months of some amazing things that we weren't taking advantage of. And so, you know, that also is one of our goals, is to continue to grow and to incorporate some of that into our work.
Thanks. So I am going to reshare our screen. And so hopefully you're able to see tools used to track data.
We see the whole presentation.
Of course you do. We'll get there. All right.
Yes, now we can see it.
Okay, so this was really important. So sorry everyone for the delay, but I really wanted to show it was important that we show you this. And just so you can kind of get an idea when we're talking about data, why it's significant in this process to know what your data is telling you. And to really analyze if you're achieving your projected outcomes, if there are any unintended consequences that have emerged. And then again, I cannot emphasize enough the staffing considerations that are part of this process as well. So here is an example, and it maybe I realize it might be hard to see everything. I just wanted to highlight, this is an example of the website analytic report that we received. And so this tells us, this is a 20-page report. It's very comprehensive, and it gives us the number of impressions, the number of the length of time someone spent on our page, what pages they're looking at, where they came from, if it came from social media, if it's an organic search, what they're looking at on our page. And so on this particular screen, what I really want to draw your attention to is the days of the week that our website receives the most sessions, and then the times of day. And so when we began to push out to social media and we began to really increase our engagement through social media, uploading resources, sharing our webinars, putting those resources on our Facebook pages, our Facebook data was telling us that we were getting the most engagement between 10 and 3. And so if you recall, initially, we started to increase our social media engagement, but we weren't seeing the hits on our website. So then we made the change and the adaptation to upload everything to our website and push from our website to our social media pages. And so this is the correlation that you see here. You see that our Facebook insight, our Facebook data was telling us that from 10 to 3, we're likely to get the most engagement. So it's no surprise to see on our website, we're also seeing that engagement. So you can see a direct correlation in our efforts, and we're able to see the data showing us that at least in this instance, we're seeing the intended outcomes. And then this is also part of our report, and I know this is hard to see, but I just wanted to point out, we mentioned the online video portal. And so the intent of the online video portal, it was for us to house a place where our videos and recorded webinars are for on-demand learning. And so families could have access to our resources at any, 24/7. With that, we also, initially we were uploading our webinars to YouTube, which is great. It's easy to upload to YouTube. It's easily accessed. Families and stakeholders are familiar with YouTube. The challenge, however, with YouTube is that it gives us total views, but it doesn't necessarily tell us who's watching our videos. It doesn't give us an opportunity to really track outcomes if our videos were in fact useful, if the information was relevant, any of that. And we created this online video portal that requires a username and password, and parents have to, or stakeholders have to register, and then they have access to look at videos that are created or previously recorded webinars. What's also great about the online video portal is that we've developed a set of questions that are that the participant has to complete before they can complete complete the video, view the video. So that allows us, and those questions communicate, this online video portal communicates directly with Salesforce. So it allows us to capture that data, and all we have to do now is we go into Salesforce and we're able to pull up a particular parent or a particular individual, and we can see the trainings that they participated in. And so what you're seeing here, this shows you the number of trainings that parents or individuals were watching. It tells us the page views. It also, there's another portion of this report that tells us how long they were looking at that particular video. I should also mention, with the online video portal, this is an example of what this looks like on our website. Our online video portal allows you to, once you've completed a video, you can download a certificate. And so that's also just another way to demonstrate that the individual has completed the viewing. So again, tying this back into PDSA, this is a great tool. What we've noticed in this process and in our assessment and evaluating this is it's difficult for families to find the online video portal on our website. So now what we're doing, we're making some changes to make it very easily accessible so you can find it on our website. So again, just keep in mind that, you know, the whole process of continuous improvement in the PDSA, there are constant challenges, and there are constant tools that are opportunities that you're going to find for improvement. And so this process really allows you to think through and think critically in terms of what's the best, what changes should we make? What's the data that supports the changes that we're making? Does it make sense? And it also, it avoids you wasting time, for lack of a better word. So you're not just implementing things, or you're just, you know, coming up with something and hoping that it works. So I just wanted to show, again, I know it's very difficult to see because the print is very small. I wanted to fit it all on one screen, but I wanted to give you a visual of this data as well. This is another data source that we've utilized as part of the process to help with our challenge. Nina?
Yes. So what we want you to do is to think about how this fits into what you do. What's one thing you can commit to as a parent organization or professional serving families that has to do with implementation science and continuous improvement. So we asked you earlier to kind of to think about it, and now we're going to ask you if you have identified an area that you might want to look at. Please put it in the chat, and we will have the chat, but also any questions you might have. I saw some questions, Meedra, in there about the video, the online portal, and any questions you have as it relates to this presentation, and then what you are going to take away from this and commit to bringing to your organization.
Yeah, and so we still have time. And so once we, as you're considering your closing thoughts, I do want to make sure that we're intentional about addressing some of the questions in the chat feature. And so I'll give a few minutes, well, not a few minutes, I'll give a few moments so you can think about your closing thoughts, but we will definitely address some of the questions that have come through in the chat.
And Meedra, I'm monitoring, so I will just ask you some questions if you are
perfect. Thank you.
So there is a question about the video portal and where it came from. What program is it?
So it's actually built, it's customized. It was custom built for us. And I do have some time. And so as long as the technology will permit and I can share my screen, I will show you briefly.
If all of those things align.
They will.
And I'm going to put the link, as somebody asked for the link, I'm going to put it in our, in the chat there.
And so, can you see our website?
Yes.
Okay. You see the portal?
Yes.
Okay. Perfect. So to answer your question, this was custom built for us. We went to our web developer and we were discussing the challenges that we were facing within the organization. We wanted to increase our participation and our registrations in our online resources, and we wanted to develop a tool that allowed families and caregivers and stakeholders to be able to access our resources on demand, but at the same time being able to capture the necessary data that we need for our trainings. And so here is as I mentioned earlier, you need to create a username and password. And then once that's created, you create a profile. And so on your profile, it has the necessary information. So if you have a child with a disability, if you have multiple children with disabilities, your contact information, all of that information is stored there. And then if you've watched any videos, these videos will show at the top of the page. You have the ability to go to all videos, and the way that we have it set up right now are videos and then webinars. And so if you click on videos, it takes you to the videos and you can listen to the video. And once you, as I mentioned earlier, at the conclusion of the video, you are then completing a pre and post test. It also, the questions include, we measure pre and post outcomes, but then we also look at, was the information useful? Was it relevant? Was it of high quality? And did it meet my needs at the moment? The other thing that I just want to mention, the way that this was designed is that we use a WordPress platform on our website. So we are able to upload the YouTube. We still upload our videos to YouTube because any data is great. I mean, we still want that data. So if we are capturing views and individuals are accessing our videos through YouTube, that's fine. We just want a mechanism, and we want to make sure that we are promoting the mechanism that gives us the data that we need to collect for our purposes as an organization. So we use the link from the way that this is designed, we use the link from YouTube, we upload it on the back end of our website, and so it still gives us the information that we need. So there's not a lot of, I'm not a technical person, so the space that would be required to house videos, we don't run into that issue because we're using links from YouTube, if that makes sense.
Meedra, there's a question about what is the overall investment for the Parent Center to consider this online portal?
So the first place is to start with utilizing the PDSA. So utilize, plan, do, study, act seriously, and look at your data. What is your data telling you? And this may be an opportunity to look at, engaging a focus group or engaging stakeholders or some of your families to determine, is this something that we need to do? Here, present the challenge to them, present what you need to achieve and what the plan is, and then you know, making a determination based on the focus group data or input from your stakeholders if this is necessary. This is a very expensive option, I will say that. However, we were fortunate that we received a grant that was able to partially fund this piece. However, I would recommend before doing anything, always implement a systemic approach. You know, it doesn't necessarily have to be PDSA, but some form of implementation science to make sure that we are very intentional. You are very intentional about the plan, what you plan to carry out, if it makes sense for your organization, and also the sustainability of it. So if we put this in place now, is this something that is going to be a useful tool for us, you know, in the next 5 years to come?
Meedra, I've had some comments about the idea of doing an intro to the webinar and pushing that out. I'm wondering if you can pull up our Facebook and show one of those. I just did one Monday. Was that yesterday? Yesterday. I lose track of days, you know, sometimes.
Easy to do.
Yeah. So, and Mia, I think it is possible to get a copy of this presentation. I'm not sure.
So the presentation is available on the Hoover app, and there are also additional links that are included in this presentation that have an actual worksheet, the PSDA worksheet that really will help guide you through the process as well. Okay, Tina, is this it? I want to make sure I have the right one. Is this it, Tina? Okay. And of course,
the sound. Do you have the sound? And I'm with
yeah, you should be able to hear it. I have the box checked.
The Parent Information Center of Delaware. Every other Monday, we come to you with a parent check-in from a parent in Delaware that is dealing with the pandemic, COVID-19, and all that is related to that. So we talk to them about their child, the school environment their child is in, the services that their child is being provided, and what they are hopeful for during this really stressful and challenging time. So, as we mentioned a few weeks ago, we have moved everything to our online video portal. I will put a link in the bottom in the comments. You can also go to our website at pickofdel.org to check that out. And later this week on Thursday, we will be coming to you with another social emotional learning webinar. Check it out on our calendar at pickofdel.org. Thank you. And I picked the one video, of course, where my 5-year-old is banging stuff and screaming in the background. I mean, this is life.
Life as we know it now.
Yes. So, but we do that for our Facebook Lives, for our parent check-ins, and for our upcoming webinars, and push it out. In the comment section, then, I put the link through Zoom. We do on-demand webinars where we can share the link, and then the parent has to register to see it, to view it. So we capture the data then. We also put it in our video portal after about a week. And I also put a link to our events page in the comment section so they can register for upcoming webinars and stuff.
So I'm also looking at the comments, Tina, and I'm noticing there's some great conversation taking place in the chat. And there was a question if the portal is integrated with Salesforce. Yes, it is. And so as families, caregivers, stakeholders, whomever, individuals register, it automatically creates a contact in Salesforce. So we are able to run a report, and we're able to see the number of individuals who registered for the online portal, not only registered, but then what particular videos or webinars they viewed. Additionally, and so that requires some back-end work. You know, this process has been a learning process for us, and it continues to be a learning process, and it's ongoing. However, and this is why I emphasized earlier the significance and the importance of really dialing in your staff and knowing, you know, identifying the competencies and what it's going to take in order to be efficient in this process and carry out the work, and what training is going to be necessary, connecting with other PTIs or other organizations that have done this. And so when I mentioned the peer-to-peer, we reached out to Include NYC because they had a pretty good understanding of Salesforce, and they were using that pretty effectively. And so we wanted to learn, and we wanted to know what they were doing. Now, let me be clear. We were comparing apples to oranges here in terms of the size of the organizations. However, the overall outcomes and the intent were the same. We still had the same, we were looking for the same goals in terms of engaging, meaningful engagement, but also really understanding Salesforce and utilizing Salesforce to its capacity, which we were not doing at the time, and we're still continuing to work on. Looks like there's another, and Tina, you may have answered this. Sharing the data analytics more thoroughly with staff directly involved in implementing social media initiatives and website postings. Absolutely. And so also part of our process, we have weekly staff meetings, and actually, and Tina and I were talking about this. We were talking about, in our staff meetings, we discuss upcoming activities, existing projects, anything that we're working on. But one thing we were not doing, we were not reviewing our data. We were not looking at our data to say, what is our data telling us? Where are we this week? The calls that are coming in, are we identifying trends, looking at our website, looking at our social media postings? We had not embedded that process, incorporated that process in our weekly staff meetings. So that's something that we are now looking at doing. And so again, you know, this is not, this is a consistent process. When you're talking about continuous improvement, it is in fact that, continuous improvement. This is a consistent process of evaluating and assessing and looking at our programs, looking at our engagement, or looking at what we want to improve, and implementing changes, and then assessing and making adaptations or abandoning the plan if necessary. There are times that we might implement something and we thought we had, we planned it, you know, thoughtfully. It was thoughtfully planned. We had the tools in place, we had the individuals in place, and then we implement it and it doesn't work. It happens. That's the point of this process.
Meedra, there's a question about, does it make duplicate contacts in Salesforce if they're already in the system?
Yes, it does. And so you do have to have a mechanism that addresses that. And so for us, what we have to do is we have a system where we are constantly looking at our Salesforce data, and we are identifying duplicate contacts. So yes, that piece has been a bit cumbersome, and we are problem solving through that. But for now, it's more manual than anything else that we are able to address that.
And then what specific data or analytics do we review on Facebook, page or private groups?
So we, I think you're asking in terms of insights, Tina. So there has recently been a change. At one time we were looking at, we wanted to make sure we were comparing apples to apples, because if you go to if you look at the insights on your Facebook page, it gives you a lot of data. It will tell you how many views you've received, a particular post received, the level of engagement, how long they watched a particular video, if it was shared, and how often it was shared. It tells you a lot of information. we were particularly interested in the post-engagement views, and we wanted to know how long they were actually on our page and they were looking at our page. But also, while that was significant, we also wanted to look at our website, because again, for us, it was critical to increase our universal technical assistance. And so we wanted to make sure that we were empowering and encouraging families and stakeholders to access the tools and the resources on our website for a few reasons. One, it gives us immediate feedback in terms of if it is in fact useful. It also it gives us the opportunity to get the feedback if they're able to easily access the information, and if we need to make modifications there. And then it's very easy, it can be very easily shared to our social media platforms. I also mentioned, I think I mentioned that our website platform is WordPress, so it's also a lot easier. We moved from a Joomla platform, which was very difficult for us, and to a WordPress platform. So that allowed us to update our website easier. It's an easier process and easier to train staff to be able to increase our capacity as it relates to that as well.
And I want to say, I'm seeing some comments that, you know, people feel they don't have the financial resources to do this. But what I hear you encouraging, Meedra, is you do not need to have the financial resources to do implementation science and to figure out what makes sense for your organization. And then if you identify that a portal would make sense, looking at the available tools that are low cost or don't have, you know, smaller cost, and then or trying to find grants and other resources to be able to use for, you know, bigger projects. So for example, there was a question about archiving webinars for to get people to register before they view it. Well, we have that in our portal, but also on demand in Zoom will do that. Now, if you would have to have a bigger membership to be able to store, you know, the webinars in your Zoom, but that is possible for a fairly insignificant, not insignificant, but a smaller amount of money than a video portal. So there are things that you can utilize to achieve similar objectives.
Yeah, and let me add, you know, COVID has presented its set of challenges and levels of stress, but it has also presented its set of opportunities as well. And had I known or taken advantage of the full functions, you know, functionalities of Zoom and the on-demand feature, because, you know, had I known of that, really taken advantage of that tool beforehand, we probably would not have invested in the on-demand webinar when we did, because we would have that feature gives us what we need. We can, if you just have to have a process in place in terms of how you're going to share that information on your social media platforms or how you're going to promote those archive webinars. But if you use the on-demand feature, if you have that available through your Zoom account, then they will have to register with a username and password, and you still get the information that you need. So Tina is absolutely correct. It's really just looking at when you implement this process and you're looking at the challenges that you have, if you're trying to engage stakeholders. And again, we're talking about Facebook. You know, Instagram is an entirely new frontier for us. We are utilizing Instagram, but it's a completely different animal, and even understand the data and the insights. And so this is something that is going to be, you may find that what works for one particular platform is not going to work. You may have to make some modifications to use it for a completely different platform.
And then the last question, Meedra, is do you use Google Analytics yourself or rely on your web developer?
Both. So we use Google Analytics ourselves internally. We have staff myself and another staff member review the data, and we also use it as a comparison. And so we look at the website analytical report that our web developer sends to us, and we want to make sure that we're seeing the same information. We use both. It was important, it was critical for us to understand Google Analytics and to understand what the data was telling us. But for me, as a director, it was important to build that capacity within the organization, so I had staff who were knowledgeable of that data as well and could interpret the data as well.
All right, and thank you everybody for joining us. In the chat, there is the link where you can download this presentation on Whova. And you can contact us. I think in that is our contact information, but you can always contact us at our emails, and I'm putting those in there, and through our Facebook page and phone number. And thank you so much to everybody that participated. We hope that you can use this information, and if you have any questions, please let us know.